Yes, Assalamu alaikum. I hope so. You all guys are fine and doing great. So, coming to our second last lecture of today's virtual dental conference on the theme of oral health awareness, we have the second international guest speaker, and he's very well renowned speaker of Pakistan, and he's the proud of Pakistan as well. He's none other. He's Dr. Abdul Samad Khan. So, without any delay, I would like to welcome our international guest speaker from Saudi, Dr. Abdul Samad Khan. Assalamu alaikum, sir. How are you?
Assalamu alaikum. Walaikum assalam. I'm fine. How are you? I hope you are fine.
Yes, sir. Alhamdulillah, I am fine. Sir, over to you. You can take from here.
All right. Okay. First of all, I would like to thank you very much to invite me and provide me the opportunity to share my experience specifically related to dental biomaterials. Uh, Assalamu alaikum, audience, and good evening or good morning, whatever the time is at your place. Okay, as you can see, my name it's Abdul Samad Khan. Currently working as an associate professor in the Department of Restorative Dental Sciences, College of Dentistry, Imam Abdul Rahman bin Faisal University. I've been here since 2016. Before that, I was in Lahore. It's Interdisciplinary Research Center in Biomedical Materials, Comsets University Lahore campus. I'm a dentist. So did my graduation in 1999 from Nishtar Medical College. Later, I did my MSc in dental materials from Queen Mary University of London in 2005. I got the opportunity of doing the PhD from the same university, got scholarship. So did my PhD in 2009 from there. Later worked as a research associate, then postdoctorate in University of Sheffield, and finally here I am currently in Saudi Arabia. Okay, so we have limited time, so I'll be quick. So my presentation, I'm not showing too many experimental work or too many results of my studies. So it's an open presentation, sort of a discussion. I don't know what's your format. Can they ask question in between, or if they want, they can ask at the end. So whatever is convenient for you, you can just pop in and let me know. Right. Okay. Let's start. The role of dental biomaterials in oral health. Uh, Screen. Okay. It's not moving further. What should I do?
Just 1 minute. Sir, I can move the screen. If you can let me know, I can move the screen.
Okay. Let me see. Why shouldn't? Okay. Fine. Let's start it like this. Clinician concern. Okay. Whatever we are doing as a dental material person, we are basically working for dentists and for patients. And whenever we have a discussion with our clinicians, they always say, okay, we need such type of material which is useful for restorative purpose. Somebody talking about the periodontal regeneration, some sensitivity. Okay, now talking about the nanotechnology and implants and 3D things. So people, they have different concerns. So, and this is the domain of as a material scientist, like we are working in different area. And so I'm not going in the detail what are the different specialty. I'm sure all the dentists, they are aware of these things. Let me see, can you move further please? Okay, fine. So this is like previously I mentioned about the concerns of the clinicians, but obviously patient and especially the celebrities, and you can see like I couldn't do the animation here, but it was like this, that all these big celebrities, they did their dental treatment, and I'm sure you all are aware of the original pictures, Tom Cruise, Ronaldo, and Cheryl Cole. Okay, so they got the treatment, and who provided them? Dentist. But behind that, it's basically the work of material scientists who gave these nice material and give them a good smile. uh, Please move forward. Okay, so here you come, like as a dental material person or biomaterial person, they have a vast field. They can go in any area from aesthetic dentistry to restorative dentistry, then implantology, maxillofacial surgery, prosthesis. So it's a huge area for a dental material person. And if anybody wants to explore this or to develop their domain, they can go in any field. But the most important thing, which is basically the topic of today's discussion or presentation, is what is the role of these biomaterials in oral health, because today is the oral health day. So first of all, we should know what is the perception of the patient. Okay, patient, they don't know about materials, to be honest. Okay, for them, they just want their treatment, a good treatment from a dentist. Okay, so they don't know like either this material is biocompatible or this material has high mechanical properties. The only thing they know, to be honest, is this a white filling or black filling? Okay, so that's the only thing. This is my personal opinion. I'm sure maybe you or the other dentists, they have some different experiences. So patients, their concern is only the to get better treatment. But what about the materials? Material science is like specifically in last 20 years, we have seen so many improvisation and innovations in this field. Like people initially they talk about macro materials, micro materials, and now they are talking about nanomaterials. And even in nanomaterials, there was simple fabrications, and now people they ask us, okay, is it a 3D printed material or it's a normal material? Okay, obviously we have to see consider different properties, and then we have to satisfy certain organizations like FDA, like ISO, like if you or even if we are talking about related to Pakistan, DRAP, the Drug Regulatory Authority of Pakistan. So we have to provide them information that this material is safe for our patients, and there will be no harmful effect specifically related to either environmental effect or health impact. But availability of these material is a concern. When we just compare two different type of worlds, like the what we call it the developed world or the developing world countries, some materials are available which are very advanced material in Western countries, but unfortunately, still we are not aware. We when we are talking about we, it means public from the developing countries. We are not aware of, or we cannot use those materials even now, thanks to this IT world. Now we are aware from Google or from YouTube or through social media, but availability of these materials is still a problem. The corporate organizations like big companies, they have their own priorities. They want to sell it, not sell it. I'm not going in that detail. Then as a clinician, what is the responsibility of the clinician? Yes, to provide better treatment for the patient. But on the other side, this is my concern, or that my question from the clinicians, like either are they aware of the basics of these material, like about the information and the science and chemistry of those material. To be honest, like I'm a clinician myself, and I'm doing a clinical work as well. uh, just with the awareness and better awareness of the material, I feel that I can provide better treatment as compared to uh, and then some other clinician which are not specially, like I'm a clinician as a general dentist, you can say, because I don't have any specialty in clinical sciences. But just because of the better awareness of the material, I know where and why and how I should use my restorative material. Okay, so at the end, the outcome is basically based on clinician and obviously the patient's behavior. Please move forward. Okay, so now in my slide, as I mentioned earlier, it's an open questions. There will be some open question, and you'll see in next 5 or 6 slides. What is the availability and acceptance of new material? Like, oh, on a daily basis, we are developing new materials. We are talking about, okay, like I'm sure vendors, they are coming to your clinics and say, oh, Dr. Saab, why not you use this type of adhesive? Why not you are using this type of impression material or filling material? Okay, so there is a lot of science, but acceptance of these material and availability of these material depends on many factors. It's not only that material has a better mechanical properties or physical properties. Obviously, we have to see so many other things, and one important thing is the cost. Either that material is cost effective or not. Okay, related to the oral health or the health concern, I'm sure you are aware of one thing that under the umbrella of United Nations, there was a conference in 2017 that's called the Minamata Convention, that is related to the usage of mercury, and it says that every country should be mercury free. So what does it mean? And Pakistan, they signed it, and many other countries, they signed it. Almost 128 or 130 countries, they signed it. So it means these countries, they will not, or they cannot use mercury. Although it's not, they have provided a timeline. So to cut it short, it means in mercury and dentistry, like there will be no amalgam. So there is no future of amalgam in dentistry. Eventually, it has to phase out. So what are the alternatives? Are static restorations, like specifically the resin based composites. Okay, please move forward. Okay, so what are next question is, what key aspects of dental materials are required for effective treatment? As I mentioned, either their mechanical properties, physical properties, biological properties, all these things we should know, and that those things are, or the that material should be acceptable for patient. And we have to see this thing, or to find out the ratio of risk and the toxic effect. I'm giving you an example. Like all of us, we are using resin based composites, okay, and these composites, if I'm going in the material sciences, these composites, they are made of bisphenol glycol methacrylate. And like we know that bisphenol is toxic, but still we are using, because the benefit of that material is more than the risk. Similarly, amalgam we are using, we know mercury is toxic, but still many countries, they are using it. So we have to find it out, or we should know either that material is acceptable in terms of its risk to benefit ratio. Next question which we should consider: does any current material pose a true biological threat to humans? Specifically, if I'll go current dental materials, okay, uh, amalgam, again, causing issue. Resin based composites, they are causing issue, but still we are using it. There are some other materials which contain some toxic components. Specifically, maxillofacial surgeons, they are aware what type of the synthetic plates if they are using, so their byproducts can cause some toxic effects. So then what is the greater concern from the biological standpoint, that material, when they place it, and if they are degradable material, so that byproduct is toxic or not? And this is the main concern related to oral health. Or even if we are using anything in the oral cavity, like suppose some drugs even, okay, for ulcers, and we have to see either we can make some new drugs, but still we couldn't find anything else other than proper one, other than the chlorhexidine and all these things. So as a dentist or as a material scientist, we are working that can we eliminate this in these toxic materials from the current material science, or from the current dentistry. Like we are working, we when I say again we, it means material scientists, they are working for an alternative of bisphenol A, and they have given some options. Maybe if you remember, like in 2005 and 6, they marketed a new material called siloxane, but now it's not in the market anymore. But that was one of the alternative of bisphenol A, where they provided that okay, siloxane is better as compared to bis GMA based material, and can provide better oral health, or the less toxic material. So moving forward from there, so we should know what is the best route to develop these type of materials, and again, whatever the best polymer, which even if they degrade or if they can cause toxic effect, so that toxic effect should be minimum. Okay, sorry, move forward. Um, So then the next thing, there's a concern, like as I mentioned initially, like people, they are talking about nanomaterials everywhere now, in dentistry or in material sciences or in biomedical application, everyone is talking about nanomaterials. Okay, we are also in restorative dentistry, we are also working on nanomaterials, and we are saying nanofiller particles have been added in these resins or in these composites, or in periodontal membrane, nanofibers have been used for periodontal regeneration. But there are some concerns, specifically the nanofiller particles, when they are using it in the for the biomedical application, they can cause some toxic effect, especially if they leach out in the oral cavity. And okay, so they are such in a small size, so they can go anywhere. And some evidences are available where these nanoparticles, they have, like the biomedical people, they found that the patches in lungs. Okay, so that's a concern. So again, we have to see as a dental material person that what type of nanoparticles we have to use and what is the required size of these nanoparticles and in which form we have to use it in resin composites or in adhesives or in periodontal membranes or even on the coatings of implant. So all these, it's not like this, sometimes it looks fancy, that nanoparticle or nanotechnology can be used, but obviously uh, we have to see a science behind it. So the manufacturers, they should devote more time and effort to design this material. So again, one important thing when we see such thing, either that material which they design, is it easiest material to handle, or some high quality material with more technique sensitive. Like as I mentioned, like one of the example is 3D printing. Okay, 3D printing, to be honest, still today, maybe in future it will be cost effective, but right now it's a very costly thing. Okay, so if we are using those materials, and similarly CAD CAM, it's a technique sensitive material, cost is involved, so who will bear that cost? Obviously clinician and eventually the patient. So the material scientists, they should work on these things, and which they are working, that it's not only that they are making material to provide better oral health care, but obviously they have to see the cost of these material and the handling properties of that material. Move forward, please. No, one slide back. Okay, so this is one more thing which has been gained interest recently, is the use of bioactive materials. Okay, so when we, especially in dentistry, so when we are saying these bioactive materials, so obviously yes, they can provide better results, better treatment, remineralization effect is there, bioactivity is there, biocompatibility is there, some antibacterial properties they can show. But again, when they have to use in dentistry, so one should know what is the biological balance, like what is the availability of calcium phosphate, fluoride, silicates, which can provide better remineralization, which can be good bioactive material. It's so we have to see what concentration is should be used. Like here I can give you an example. If these bioactive material they are using in composites, so sometimes we think that if we increase the weight percentage or concentration of these materials, the mechanical properties will be increased or some other physical properties will be increased, but it is not like this. Because on one side we have to see the, like suppose refractive index of these material, like either the light, the blue light which the dentist you are using to cure these material, either that light can pass through this material or not. If they are not passing it, what happen? The material will be uncured, and uncured means unreactant monomers, and those monomers has to go somewhere. Okay, so it can cause toxic effect. So you have to see what is the balance, what is the biological balance of these material. And then also you have to see the ratio of the demineralization and sorry, and the remineralization of these material. So there you have to select actually what type of bioactive material can be used. Either we should go for hydroxypatite, we should go for bioactive glasses, we should go for calcium silicates. So that bio-inspired complex material, it's not easy science. So we have to see, we have to judge related to its clinical application, and also the end product and related to its health concerns when we are using it in dentistry. Okay, can you move forward, please? Okay, next, please. So this is just a brief outline like about the journey of dental materials in 1980 till 80s, or before that people they were talking about silicate cements or the glass ionomers, or some in impression materials about alginate. But later we have seen many improvisation and new innovations in dentistry. In resin composites, some advanced composites are there. Antibacterial agents have been used. Bioactive materials is been in use. Similarly, in periodontal regeneration, some periodontal membranes are available, from natural to synthetic polymers. Prosthesis, or the fixed prosthesis, like from simple metal crowns to porcelain fused crowns, and now they are talking about the all stamp crowns. So the things have been changed, and regenerative dentistry or regenerative medicine has gained a lot of interest, especially in maxillofacial surgery and in endodontics. So biomaterials which we have, either they are synthetic or natural. Okay, so we can use these material accordingly, and obviously natural biomaterials, they are better. So what type of the ceramics we can use, like as you can show in therapeutic purpose, nanoparticles, they can act as a for the drug delivery, and they can provide better treatment in for the oral health care. Then there is another thing called the self-healing material. These self-healing materials, they are alternative of resin-based composites, where they are putting some capsules which has contained some drugs or some products like this, which can heal. Like it can go in the oral cavity, and when there is a salivary interaction, they leach out such type of material, which can heal, and which can reduce the sensitivity, and also it can help to regenerate the appetite layer. Move forward, please. Okay, in periodontal regeneration, like, okay, we can skip this thing if we are running out of time, because this is just an example. Like we are talking about bioactive material coating of the implants from the oral health. Like previously people, they were using the titanium alloy implants. Now it's about the zirconia and deuterium stabilized zirconia, and also the coating of nanoparticles, and coating of the proteins and some inducing factors on implants. Similarly, when we are talking about bioactive glasses, main family is calcium phosphates, and this is the area where the dentistry or the restorative dentistry is going, where these bioactive materials, especially hydroxyapatite bioactive glasses and silicates, is being used in restorative dentistry, in endodontics, in periodontology, even on coatings on orthodontic brackets and wires. Okay, and some endodontic sealers, they have gained interest. Like MTA is one of very common example, but recently biodentine and biosealers is been in use in last couple of years. Then lastly is about the digital dentistry. Uh, as I mentioned earlier, like with either digital dentistry can be used to develop the prosthesis for orthodontic purpose, or even for endodontics and restorative dentistry. Again, so it's this is the area which is that is the future, and the yes, you can move forward. And digital dentistry, and along with the nanotechnology, so that's the area where the people, they are working, and with the approach of interdisciplinary, where material scientists and the biological people, microbiologists or molecular biologists, along with dental or dentists, so they all can work together and to develop such type of material which are biocompatible, and which can provide better treatment, and to enhance the oral health care. Right. Okay. Thank you very much. I have to be very quick because we have to finish everything in just 20 minutes.
Sir, thank you very much for the valuable information you shared, and please having like a time from like Saudi, and you were like our international speaker. So, sir, very grateful for you. Okay, sir, I have just a question, sir. People are asking like, what's the scope of nanomaterials or biomaterials in Pakistan like these days? Is there any working happening or not?
Yes, there is. Specifically, when we are talking about the dental materials and nanotechnology, yes, in Pakistan, even I know some centers or some students, like people like in from the field of dental materials, they are developing nanofiller particles. Either they are zirconia, silica, or even this hydroxyapatite and bioactive glasses. Even when where I was in IRCBM Comsets University, It's a very like specific center for dental materials and biomaterials. And my students and my other colleagues, they are working in the field of nanotechnology over there. So yes, there is a scope.
Sir, if I like talk like a layman and not as a doctor, sir, if I am supposed to like get a filling and I come to you at your clinic, so sir, I would be like asking, sir, please do silver coated filling or like चांदी की फिलिंग कर दें, ठीक है, अगर उर्दू में बात की जाए, ठीक है, चांदी की फिलिंग कर दें या मुझे बस फिलिंग कर दें, ठीक है. सो इन पाकिस्तान यू नो दैट सिल्वर कोटिंग फिलिंग इज रेफर टू एज मर्करी फिलिंग विच इज अमलगम. ठीक है. सो सर, at most of the places in Pakistan, this is now an obsolete in the practice. Not they are not using it. ठीक है. But I'm just about to ask. Uh, so I am just about to ask here, sir, as you told, like mercury, that Pakistan also signed no mercury usage. So, sir, are we like going on a good oral hygienic domain? In future, like we will be studying more about bioavailability of material and not using it for like purposes of just like mercury toxic effects, etc. I think you are getting my point.
Yes, I think yes, I think as I mentioned in my slides or in my presentation that to be honest, there is no future of mercury or amalgam. People now they are
Yes.
talking about is even the patients, they are concerned about aesthetic fillings. Okay, they said
Yes.
okay, we don't know, we don't want any black filling or silver filling. They ask you about, so all the advancements and all the innovations and even the companies, they are putting money on aesthetic restorations. Okay, and that's how they are making money out of it. And they convince their to dentists to use these materials. But as a dentist or as a material person, what we want, we need that material at least should become like compatible, or to bear that masticatory load, or to have such mechanical properties, so that it can be used at least initially. If, remember when we like just 10 or 12 years before, we thought that the life of composite restoration is only 5 years. Now they're saying that it is 15 years or even more. I have seen many filling like for even one of my filling, if restoration is there, composite, it's been there like more than 20 years and it's perfectly fine. So the future is basically related to resin based composites. What type of the resins, what type of the fillers you can use, that's the improvisation and innovations can occur.
Sir, lastly, I would ask in Pakistan if anyone is interested in further doing any masters or like doing PhD in dental materials. So, is there any institute like who is offering such programs in Pakistan
Yes,
for
yes,
the
there are
research?
many like, yes, there are many
Research.
like okay, let's start like this very quickly. In Islamabad, Islamic International, they are offering MPhil program in dental materials. In Lahore, PGMI, Lahore, they are offering this thing in Peshawar, or in Peshawar Dental College, Gandhara University. They are offering KMU, Khyber Medical University. They are also
Oh,
offering PhD in dental materials. And in Karachi, Dow University, they are offering MDS program in dental materials. So there are many institutes. I'm sorry if I'm missing anything. Maybe some other
no.
institutes, but like quickly, if it's not coming in my mind. But I know like many institutes, they are offering postgraduate program in dental materials.
So, okay, sir. So, sir, again, thank you very much for your great time and coming on very short notice in this oral virtual dental conference. Sir, thank you very much, sir. बहुत बहुत अल्लाह आपको खुश रखे. सर खुदा हाफिज. ठीक है सर.
चलें, बहुत शुक्रिया, बहुत शुक्रिया। अस्सलाम वालेकुम। अस्सलाम वालेकुम।
बस हाँ.